There's different special enrollment periods. There's a Part B as in boy special enrollment period. And that is just a specified timeline that allows somebody to jump into Part B mid-year without a delay in the effective date of coverage. Typically speaking, we're talking about people who are working past age 65 and have employer group health coverage, or they are working and their spouses are on that employer group health coverage, their legal spouses. So anytime while they're working and up to 8 months after that employer group health plan ends, they have a special enrollment period to jump into Part B as in boy. There's one other instance where that may also apply, and I have on that last bullet may qualify if they're volunteering or serving in a foreign country, for example, like the Peace Corps or a missionary, where there is health coverage through that volunteer program. So Peace Corps volunteers do not have to be enrolled in Part B. There are other volunteer organizations where that may apply as well, as long as that entity is providing major medical insurance. Now, one other situation that I was thinking about that I didn't get on this bullet is if somebody is working for a foreign entity, they're working in a foreign country, they're working for a foreign entity, and that foreign country offers a socialized healthcare system that all employers pay into. That is also considered a active work group health insurance, even though it's not an individual company's health insurance policy. A lot of those foreign employers pay into that socialized health system for that country, and that's how their employees are covered under health insurance. So that is one other little side note on the employer group health coverage. Doesn't work if you're retired and you have retiree coverage from that company. It only works through active work. So the same rules apply as if you were living in the United States. It has to be active work group health coverage through that employer or that employer who is paying into that social health program. Next slide, please. The next special enrollment periods we're going to be talking mostly about are the Part C and Part D special enrollment periods. And again, I want to make sure we are clear on the definition of what that means. So if it's a Medicare Advantage plan or a prescription drug plan, it's a specified timeline when somebody is allowed to add, drop, or change a prescription drug plan mid-year. So they have some circumstance that qualifies them to make that change outside of the normal parameters of, let's just say, the fall open enrollment period, October 15th to December 7th. So we're going to take a look at all those different scenarios. We're not going to address each one individually, but we are going to look at the most common ones, and then we provided a handout that Miranda and I have been using quite a bit in the office to try and find circumstances that might apply for our clients when we're trying to pull rabbits out of a hat, basically.
Or magicians.
Yeah.
For sure.
Yeah. The second bullet on that last slide just said the change is usually effective the first of the month following the enrollment action. And once that enrollment action takes effect, that SEP period is closed. So even if somebody has a 60-day SEP, let's just say their plan decides to not renew, and they get to January and they don't have any drug coverage. So they take an action in January. They have a 60-day SEP at the beginning of the year, and they take an action in January, and it takes effect February 1. Do they have another opportunity to make a change because they're still within that 60-day period? Miranda?
No, they don't. I was thinking though, if they started off the year in a Medicare Advantage plan and had the Medicare Advantage open enrollment period, that if they made a change because of the enrollment period hierarchy, they would actually be utilizing that enrollment period, and then if they had an SEP, that would be second, and they could have another opportunity.
Well, that's a little more complicated than I was thinking. I was actually kind of just thinking, yes, that probably could. We could work that scenario maybe later on in the presentation. But if somebody's plan terminates as of December 31st, they start the year with no insurance other than original Medicare.
Mm-hmm.
And they have a 60-day period to enroll in the plan of their choice. If they make an action in January and it takes effect in February, that SEP is done. They don't get a second chance, even though the 60 days has not yet expired. So once that enrollment action has taken effect, that period has closed. They don't get a chance to redo in that 60-day period. Okay, that's kind of where I was going with that. So that's that first one on that Medicare Advantage PDP SEPs bullet. The first bullet, non-renewal SEP. So folks find out sometimes after the fall open enrollment period has ended that their plan has decided to pull out. And if they didn't take an action during the fall open enrollment period, they actually can take an action in December, starting on December 8th. And again, the plan would take effect the very first day of the month following that enrollment action. But they have up until the end of February, which is that 60-day timeline after the plan has ended, to take an action into a plan of their choice. The caveat here is when they are notified that their plan is going to terminate as of 12/31, if it's a Medicare Advantage plan with drug coverage, they're not going to have drug coverage when they get to January. So they're going to have to figure out, pretty quickly what to do unless they have subsidy. Anybody who has LIS subsidy is going to be auto-enrolled at that point into another plan, typically, or they're going to have line-net benefits in that interim between their plan ending and their choice of the plan. In years past, we've had 5-star SEPs, and that's been a really nice option for a lot of our beneficiaries when they're stuck mid-year and they have no other options. We've always had an opportunity to at least fall back on that 5-star SEP as a safety net. But this year we don't have that. We don't have any plans that are 5 stars, so that is not available to our beneficiaries this year, unfortunately. The SEPs for dual eligible individuals, and those are folks that have either full Medicare Medicaid or partial Medicare Medicaid with MSP, Medicare Savings Program. Right now we have a lot of talk, and Medicare is trying to wrap their arms around how to help folks who have opioid overuse issues. And what we learned in the fall update training last September was that the folks that have subsidy, instead of having an SEP every month, are only going to be limited to 3 in 2019. So they get 1 SEP each quarter of the first 3 quarters. Now there is a caveat with that, because I haven't seen it yet. Miranda, have you seen it yet?
Not
Okay.
yet.
My counselors in Multnomah County haven't seen it yet either. There's something called at-risk or potentially at-risk flags that could be put into those folks' record. Typically it's going to be if somebody is either multiple prescriptions, multiple prescribers, and multiple pharmacies, any of those three, for opioid medications. Or it could be that they have one prescriber and one pharmacy, but they have a dosage that is exceeding what the recommended maximum should be. And those folks might have a notice sent to them by their plan or Medicare saying you are at risk or potentially at risk for overuse, and we're not going to allow you to make any changes. So choose your plan wisely, because you will not be able to make a change anytime during the year. You're going to be locked in. And that's, I think, intended to help people avoid doctor shopping, pharmacy shopping, to facilitate that overuse.
And that is specific to the special enrollment period for subsidy. So if they move, they would not be locked in if they needed to find a plan that's available in their new area.
That is correct. All other SEPs are available to them, just not the LIS SEP. You are correct, Marina. Yes, yeah, good to clarify that. And then the last bullet on this slide says, see handout about other SEPs. So if hopefully you have downloaded the Medicare Rights Center latest updated SEP chart as of January 2019, and on the third page, excuse me, and I wish I would have put page numbers on these, there is a whole table of contents, and that is really helpful when you're trying to figure out which of the SEPs you think might apply to this particular situation, whatever that is that you're dealing with. I made a couple of notes on mine because there are one other SEP that's not listed on here, but I believe it is available to us as SHIBA counselors when we do an enrollment. So if you have it in front of you, I would put number 21 on that table of contents. And number 21 would be you return from living outside the U.S. When you live outside the U.S., you are not living in any service area of a prescription drug plan. And so you are not eligible to enroll in that prescription drug plan. And you cannot be held accountable for late enrollment because you're not eligible. So when you come back from living outside the U.S., you are given a special enrollment period to pick up a drug plan at that point in time. And that could be an MAPD as well.
I do believe there is one more SEP that is not on that chart that I recently encountered. And if it is on there, please correct me.
Okay.
But the one where if you're living in an area and you have a Medicare Advantage plan, and let's say there's only 3 available. So let's say you're living in Union County, you have MODA, and you move to Salem, Oregon, where Salem, Oregon also has MODA, but they have 10 other Medicare Advantage plans available. Is it on here?
It would be, I would consider that number 9. You move permanently and change your home address. So if you move and you change your home address and there are more options available to you or different options available to you.
It says that. I have this situation with a counselor.
Okay. So number 9 says you move permanently. You will have an SEP if you move out of your Medicare Advantage plans or Part D service area, or if you move to an area covered by your plan but more plans are available
Wonderful.
To you in your new area.
I wonder if we were looking at the one that hadn't been updated yet.
Okay.
Because it did not say that.
Okay. So yeah, I highly recommend, and Miranda and I regularly spar on some of the particulars of this. We had a situation last summer where we had somebody who was choosing to leave their PERS retiree plan. And so on this list of table of contents, let's see if we can find that particular one.
And number 1.
And I believe it is
1 or 2.
Number 2. You choose to change employer union coverage either through current or past employment. So that would mean that that is retiree coverage. So let's look at number 2. You choose to enroll in or disenroll from your employer or union-sponsored Medicare Advantage plan or Part D plan, or you choose to disenroll from a Medicare Advantage plan to take advantage of your new employer or union coverage. And you get an SEP. This is contrary to a lot of what we used to think, that it had to be through no fault of your own. So for a Medicare Advantage or a prescription drug plan, folks can choose to terminate their retiree coverage and still be able to replace that retiree coverage with something that's available on the open market through the Medicare system. So I just wanted to point, I'm glad you pointed that one out to Miranda, that I was saying, no, it has to be through no fault of their own. That only applies to guaranteed issue. So a little bit different rules when it comes to Medicare Advantage plans and prescription drug plans.
And one other one I don't see, correct me if I'm wrong, is Linda just recently found that if you are newly eligible for VA coverage, that you have an SEP. And I don't see that on here.
Actually, I found it because
Did you find it?
I did have to look for it pretty carefully. So Miranda's talking about, let's see here.
And it's little things like that where your first instinct is, all because you're eligible for VA doesn't mean you have an SEP, right? That's what you would think first when someone calls and says, I want to enroll in a Medicare Advantage plan and they won't let me. And you ask, well, why do you think you have a special enrollment period to enroll in a Medicare Advantage plan? And they say, well, I just found out I'm eligible for VA coverage. It's not intuitive.
Right.
So it really helps to have a resource like this to look at, to help clarify whether or not there is indeed an SEP. Which number is it?
So this would be number 1, and it would be the second line item under number 1. You have an SEP if you want to disenroll from Medicare coverage to maintain or enroll in another type of drug coverage such as VA, TRICARE, or a SPAP. We don't have any SPAPs in Oregon, so that doesn't apply to us. But if somebody is newly eligible for other coverage, they get a chance to jump out. So again, I cannot understate the importance of referring to this nice consolidated resource of SEP enrollment periods, specifically, again, to just Medicare Advantage plans and prescription drug plans, so that we can make sure that we're maximizing the opportunities for our clients. Now, one other situation that isn't on here, and it's not available to us, but it is available to our beneficiaries, but it has to go through Seattle Region 10. They have to push the buttons, and that's for anybody who is entering or leaving hospice. We are not able to make that enrollment change, but if you send it to the state office, we can send it up via fax to the regional office, tell us what plan they want to get into or out of, and then the regional, because of their hospice designation, and then we can facilitate that as well. But that's not something that's available to counselors or the state office. We have to go through the regional office of Medicare.
So we can initiate it.
And we can. We absolutely can.
That's great.
All right, I wanted to touch a little bit on the hierarchy. So the Medicare manuals discuss this at length, and if there are multiple opportunities to make a change, then there is a hierarchy of how those changes have to be processed. If someone is in their initial enrollment period, and maybe they're eligible for subsidy right out the get-go, they're going to still use their IEP, their initial enrollment period, because it is at the top of the heap. That takes precedent over any other situations that they may have. We sometimes do find that this does complicate things for folks who are retiring around their 65th birthday. I had a situation where one of my clients turned 65 in September, She had planned to retire at the end of December that year, which would have been the 7th month of her IEP. So 3 months after her birth month, October, November, December, in our chart under IEP, it says, well, if you notify Social Security in that 7th month, there is a 3-month delay, or the Part B does not start till the 3rd month after that. So she was looking at a March 1 effective date for her Part B. She was expecting she was going to get a January. She wanted her employer coverage to end the end of December, and she wanted her Medicare B to start January 1. But she did not notify Social Security until that 7th month, and that really messed things up. So IEP takes precedent over all situations, even though she was eligible for a employer SEP, it was not available to her because she was still in her IEP. So what she ended up doing was she worked 1 more month in the month of January. Now she's out of her IEP. She still has employer group health coverage, and then she started her B in February. So we just need to make folks aware that if they have multiple enrollment opportunities, there is a hierarchy that is imposed, and there's no way to get around that hierarchy.
For example, like when I misspoke earlier when you were trying to make a point about the Medicare Advantage open enrollment period, if someone starts off the year in a Medicare Advantage and they have subsidy, they could potentially make 2 changes in the first quarter.
Correct.
If the first change would fall under the Medicare Advantage open enrollment period, and let's say they did that in January with coverage to start February 1st, and then they decided they didn't like that plan and wanted to make another change for coverage to start March 1st, or make a change in March for coverage to start April 1st, that would be their LIS special enrollment period.
That is correct. Yes. So they would have to use that if they're in an MA plan and they want to make a change, they would have to use that MA OEP first before they could use their LIS. That is correct. So this is just so you have a clear understanding of how that hierarchy can impact your beneficiaries when you are counseling them. Oh, Mitch says we lost audio.
Oh, that was a long time ago.
Oh, that was a long time ago. Okay. Okay. We're going to flip over to the Medigap side and talk about guaranteed issue. So sometimes I hear counselors say, well, do they have an SEP are more strict and some carriers are more lenient. And just because one carrier says, no, we're not going to write you a policy, I would not discourage your clients from going to a different company and applying at that company. So it could be that one company is not willing to write the policy, but another company is. When you do go through underwriting, if they have, as I mentioned earlier, if you have some medical situation in your records, they can add a rate factor. That's a surcharge based on the, what do I want to say, anticipated cost to them for covering that particular treatment. So if somebody, let's just say somebody is taking a medication that causes bone loss, and that person is a fall risk now, and they anticipate that if they fall, they might break something, they might add a surcharge to that monthly premium to cover the expense of covering a potential fall. I'm just making this up, but that's probably a fair scenario. Filling out these applications truthfully is really important. If somebody doesn't fill it out truthfully and within 2 years the insurance company finds out that, oh yeah, they really did have a condition that they said they didn't, that is grounds for termination. And that could leave somebody high and dry with only original Medicare and no secondary coverage. So we want to make sure that our clients understand that they need to fill out those applications truthfully, but they don't necessarily have to spill their guts and tell every last little detail about what is their health situation. Because a lot of agents will say, la, 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 I don't want to know, don't tell me, especially if they're answering underwriting questions. We want to make sure that folks just are as truthful but as brief as possible. And if the insurance company wants more information, they will let you know. Okay. So we've got the guaranteed issues within 6 months of Part B start date. We've got 63 days from the loss of other coverage, which includes the the state Medicaid program that acts like a secondary, so that would be the Oregon Health Plan or Qualified Medicare Beneficiary Status, QMB, that pays the 20% after Medicare and the deductibles. We've also got the annual birthday rule for existing policy holders, and that comes up every year starting on their birthday and going for 30 days following. Now, I have heard that some carriers are more lenient. Now that Oregon has that birthday rule, my understanding from counselors is that AARP United Healthcare allows that birthday rule change all year long. And not only are they allowed to jump in if you're an existing policyholder at another company, if you are a United Healthcare AARP policyholder, you can switch to any of their plans. You're not limited to only going from like to like or less benefits. You can actually trade up as long as you are an existing AARP United Healthcare policyholder. I haven't actually counseled somebody where this worked, but it is something that I've heard from multiple counselors that it has worked. And I did refer one of my clients back to their agent with this information, and I'm hoping that he can go from a Plan N, as in Nancy, up to a Plan F, as in Frank, because his Plan N $20 copays is costing him more than $100 a month. He's got 5 or more office visits every month, and he would be much better off paying a little bit more in monthly premium for that Plan F and not having that $20 copay than if he were staying in that Plan N. So I'm really happy to get that information. You may run into situations where that would be a benefit as well. The next to the last bullet on there is the MA plan 12-month trial right. You must be choosing a Medicare Advantage plan at age 65 in your initial enrollment period to exercise your trial right from that MA plan into a guaranteed issue Medigap policy. The reverse, going from a Medigap policy to your very first MA plan, doesn't have an age requirement on it. So if you started off with a Medigap policy and you left that Medigap policy to go to your very first Medicare Advantage plan, and we can look up if it is their first Medicare Advantage plan. We have access at least till the end of this year with marks to see what their enrollments were. We can say, yeah, you can go to a Medicare Advantage plan, try it for 12 months, and if you decide not to stay, within 12 months you can go back to your old Medigap policy if it's still being sold. So we have a list of all the guaranteed issue parameters in our guide on page 32, and that gets updated regularly when anything new comes along. So it's really helpful to have that as a resource as well. When folks don't have guaranteed issue, they can always apply for a Medigap policy anytime during the year because there is no season. The problem becomes, however, is how do they get out of whatever they're in? If they're locked into a Medicare Advantage plan and it's April, they're outside of that MAOEP time frame, they're not, unless they have some other special enrollment period, they're not going to be able to get out of whatever they're in. Now, if they're just in a prescription drug plan, no problem. They can apply for Medigaps until they get a carrier that says, yeah, we'll issue you a policy. They're still going to have to go through underwriting. They're going to have to answer all those medical questions, and they may need to provide some medical history, but hey, a no answer is not a big deal as long as they're telling the truth on those applications. If someone does have an SEP to make a change into or out of that Medicare Advantage plan, then that SEP only has one action. So I'm thinking specifically in the case of either a trial right or a MAOEP. Somebody arrives in January, they've got a Medicare Advantage plan with drug coverage. They didn't realize that something was not right. They didn't make a change in the open enrollment period, the fall open enrollment period. Maybe their physician doesn't take that plan anymore. Or maybe their premium has doubled. Whatever the case is, they have an opportunity. At that point, they can apply for a Medigap policy. They should not let go of that Medicare Advantage plan until the policy has been issued. Because what happens if they apply for that Medigap policy, they tell their plan, hey, I don't want your plan anymore. The Medigap comes back and the company says, no, we're not going to issue you a policy. They've let go of their Medicare Advantage plan. They haven't even enrolled in a drug plan. Now all they have is original Medicare with no drug coverage and no secondary insurance. So it could be very financially impactful if they don't time this exactly right. So best practice would be arrive in January with Medicare Advantage, apply for a Medigap policy. Agents will sometimes ask clients to sign a paper saying, I intend to disenroll from my Medicare Advantage plan. That's fine. They can sign it, but they need to keep that piece of paper, because if that piece of paper gets faxed to their Medicare Advantage plan, that's their one action. So clients need to hold on to that piece of paper, wait until that Medigap policy is issued, then enroll in the prescription drug plan of their choice, which automatically boots them out of their Medicare Advantage plan. Now they've got Medigap and prescription drug, and they're on their merry way for the rest of the year. So that timing can be a little critical. If someone doesn't apply for a Medigap until, let's just say, January 15th, and the carrier has 30 days to decide whether or not they're going to issue a policy. So they find out in February sometime that, yes, we'll issue you a policy. They don't want a February 1 start date. They want a March 1 start date. So they would have their enrollment action for that prescription drug coverage in February to boot them out of that Medicare Advantage plan, so everything is going to change at effective March 1. So I know that's a lot of timeline-specific information. Hopefully it's understandable. If not, certainly email Miranda or me, and we're happy to coach you through that. We do have some guidance, I believe, in our guide on how to accomplish that step-by-step instructions. All right. So when we're talking about that Medicare Advantage open enrollment period, this is that new period that started in 2019. It begins on January 1 and it ends on March 31 of every year. And you have to start the year on January 1 in a Medicare Advantage plan, with or without drug coverage. If you are in a Medicare Advantage plan, let's just say somebody starts with just Medicare Advantage, no drug coverage. They didn't realize that they were in a plan without drug coverage, and they want to take an action. They can enroll in another Medicare Advantage plan with with Medicare Advantage and drug coverage effective February 1. Anytime you have an enrollment action in the month, it always starts effective the first of the following month. So this is a nice little do-over for our beneficiaries, and I'm really glad that Medicare is allowing folks to have this opportunity to make changes, because I know you guys are experiencing folks that come in January all in a titter because they didn't realize this or that situation has arisen, or the contract for a particular plan did not renew with a particular group of physicians, independent physicians.
$0 premium was going up to $40 a month.
Exactly. So we do have folks that have circumstances where they want to get into a different Medicare Advantage plan, and we also have folks who want to apply for apply for Medigaps that are outside guaranteed issue, and they don't know if they're going to get a policy issued. So it's helpful to have that 3-month period for folks to test the waters and see if there are opportunities to get into something that is going to work better for them. Oh yeah, that's that last bullet. Do not allow insurance agents to submit any disenrollment forms. Tell your clients to hold on to those forms until they're issued the policy, because that has really caused some havoc with our beneficiaries. Okay, was that it? Yes, that was it. So we're going to open it up now, and if you guys have any questions.
I'm going to unmute everyone. Give me just a second here.
Okay.
And then I'm going to give microphone rights. Also, I'm unmuting everyone's speakers.
Okay. Microphone rights for participants right there. Here, you got it.
All right.
Okay. So we had a pretty robust discussion at the Multnomah County Masterclass on Monday. So if any of you have questions, hopefully we can have that same kind of robust discussion on this topic as well. Any thoughts?
Any questions? If you feel more comfortable, you can also type in your question.
Yeah. Okay. Well, having heard none and having seen no questions on the Q&A or the chat feature, I'm assuming that it was all as clear as mud, or it was really clear, and this is just a nice review for research credits so that you guys can take it and run with it.
And if anyone wants to ask a question that's just listening on their computer speakers, after I address Mitch's question, if you want to type in your phone number in the chat area or the question and answer section, because I believe that just comes to me, I'm happy to call you so you can call into, so it can connect you into the conference as well. That is an option. So, are there other lenient Medigaps?
Mitch is asking if we know of any other carriers that are lenient. I'm thinking for underwriting. That's what I'm interpreting that question to be. The only ones that I have heard are AARP United Healthcare. Mm-hmm. My guess is agents, since they deal with multiple carriers on a regular basis, would be a much better source of that answer. Since we don't process applications for Medigaps with underwriting, we wouldn't know. But certainly if you have a relationship with the agents in your community, which I hope SHIBA is, reaching out to the agents in their community, yes. That would be something to talk to them about.
And Mitch is from
Lane County.
Lane County, and they have a very good agent relationship.
Yeah.
All right. It appears no one wants to know more. Okay, I guess we'll call it you're very welcome, Mitch. I guess, Steve has a question.
Is it better to go through an agent or a company? Directly. You know, Steve, I would probably defer to an agent, and here's why. An agent is your local community resource, and they depend on the word of mouth, and their reputation is the most impacted by serving their clients well. And so I would always want to have somebody who is in my corner locally rather than going through a voice over the telephone. And that's why we have created that agent locator tool on our healthcare.oregon.gov website. Those agents, by zip code and by product that they sell, have been vetted by the state. They've taken extra training. They have had no complaints that have been substantiated. That is an agent that I would want to deal with. Thanks for that question, by the way. And again, SHIBA is working diligently to foster better relationships to the agent community, because when it comes down to crunch time and it's open enrollment and we're all as busy as can be, sometimes we can't get people into appointments to see counselors, and we need to refer to those agents that might have time to help those folks. And Mitch is asking, are you suggesting that when we assist someone who wants a Medigap that we should liaise with an agent to make that happen? Well, we are not allowed to refer to an individual agent, but we are allowed to refer to Oregon Healthcare, healthcare.oregon.gov, find help search tool, agent locator tool. And we typically want counselors to give beneficiaries at least 3 to choose from. We don't want to direct business to an individual agent, because if we start directing business to an individual agent, then the other agents in that area are going to get upset with SHIBA, and we don't want the agents to get upset with SHIBA.
And we're already trailblazers by the simple fact that we even have an agent locator tool.
Yeah, we had to get special permission from ACL, the Administration on Community Living, to even have the agent locator tool available to SHIBA counselors. But it's a public-facing tool, so it's just something that we refer to. But yes, we would want to utilize that tool, give our counselees a list of people to choose from, and then they take it from there. Thanks for that question. I appreciate that.
Looks like Winnell is typing. Oh, okay. Thank you, Winnell. That's great.
Okay.
All right.
All right, folks. Well, I know you got other things to do on this cloudy day, so thanks for joining us, and we really appreciate you spending the time with us. Have a great day.